My name is Alhamoudi. I will be performing head-to-toe assessment in this video. So first thing, when I walk into the patient's room, I would wash my hands, put gloves on, introduce myself, and check the patient's identities and start the procedure when I have the right patients. So let's pretend that I have washed my hand, put gloves on, knock, knock, knock. Hello, my name is Alhamoudi. I will be your student nurse today. Can I see your wristband, please? Okay. I have the right patient, so I'm gonna go ahead and start the procedure. So first thing, I'm gonna check the patient's orientation. Can you tell me your full name?
I don't know exactly.
And date of birth?
August 1st, 1992.
And what's today's date?
December 13th, 2020.
And the year you said?
2020.
And who's the president?
Trump.
Okay, and why are you here?
For physical.
And where are you?
At home.
Okay, so I have checked the patient's orientation, and I have also checked the patient's speech. She is clear and coherent, and she's able to handle any problem. Now I'm gonna check the muscle strength. So Ayuna, I'm gonna put my hands on your cheek, and I want you to push against resistance, okay? So we're gonna check this here, and then I'm gonna put my hands on your forehead, on your chin, and then in the back of your head, okay? And then I'm gonna put my both hands on your shoulder, and I want you to strike against resistance, okay? And now I want you to do this for me, okay? Push against resistance, also here, and then I want you to squeeze my fingers, okay? And then push against resistance, and here, okay. So the patient, her muscle strength are intact, bilateral, and symmetrical, no weakness or deviation. Okay, she's 5 out of 5. Okay, now I'm gonna check for the dermatomes. Okay, so I have this one. This one's gonna be sharp. This one's gonna be soft. So, I want you to close your eyes. I'm gonna first, before you close your eyes, I'm gonna pink you with this. This is gonna be soft. This is gonna be sharp. First, let me check. What is this?
Sharp.
And this?
Soft.
Okay. So I want you to close your eyes, and then I'm gonna poke you with this, and then tell me where did I poke you and what is it? Is it sharp or soft? Okay. So close your eyes.
Sharp, upper right leg.
Okay. Close your eyes again.
Soft, upper left arm.
Okay.
Sharp, lower left leg. Soft, lower right leg. Sharp, right lower arm.
Okay.
Soft, upper right arm.
Okay, good. So your sensation is intact, no abnormalities. Okay, so now I'm gonna check for the deep tendon reflex. So I'm gonna use this tool as my reflex hammer because I don't have one. So first thing, I'm gonna check for the biceps tendon reflex, which is C5 to C6. So I want you to do this for me, and I want you to relax. I'm hitting right above the elbow. Okay, and here as well. Okay. Now I'm gonna check for the triceps, which is C7. So I want you to do this for me. Okay, so I can locate your tendon, and then, okay, and then here as well. Thank you. Okay, and here she's also having +2, which is the normal reaction. And also now I'm going to check for the brachioradialis, which is C6. I'm going right above the radial bone. Okay, in here as well. Okay, and she's also +2 in this for C6. Now I'm going to check for the knee jerk, which is L4. So I'm going in the soften area right under the knee. Oh, okay. 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 And now I'm gonna check for the ankle, which is Okay, and now I'm gonna check for the Bushinski, which is also for the sacral nerve root. So I'm gonna hold the feet like that, and I'm gonna go from down. Okay, and her toes are getting together and pointing downward, which is the normal reaction. And for the children, it's normal. What's not normal is getting together and pointing upward. It's normal for kids to have to point upward until age 2. Okay, now. Okay, and her tendon reflex her tendon reflex are intact, and they're within normal limits, which is +2. So now I want to ambulate you, so I want you to stand up right here. Okay. Now I'm gonna ambulate the patients. Can you stand up for me? And I want you to take 5 steps forward on flat feet. Okay, and stop right there. And I want you to take 5 steps back on your heels. Okay, and now I want you to take 5 steps forward on your toes. Oh, I'm sorry, I meant forward that way. Okay, and now I want you to take 5 steps on straight line. Okay, so now I checked for the gait balance. She maintained balance and as her station. Okay. Okay, now I'm gonna check the patient's hand, which is eyes, ears, nose, and mouth and throat. So first, I'm looking for the shape and contour of the shape on the contour of the patient's face. I'm gonna palpate and look for any lesion, any scar, any abnormal shape and size, and plates of the head and scar. They're intact. Okay, and now I'm gonna check can I see my pen light? Okay, and now I'm gonna check for the pupillary response. Can you take off your gloves? Your glasses, and I want you to look on my finger. And I'm looking at the pupils. They're round in shape, and they're reactive to light. And they shrink to 3 milliliters. Now I want you to look at my pen light. I want you to follow it without moving your head, okay? So. Okay, and her pupils are accommodate together. Now I also I'm gonna put her pen light, and I'm gonna see if her pupils they reactive to light at the same time. So I want you to look straight. I'm gonna also, can you take your glasses off? Okay, I'm gonna also put a pen light on your right eye, but I'm gonna look at your left eye. I'm gonna see if they respond to light at the same time. Okay, so I want you to look straight. Okay, I'm flashing light in her right eyes, but I'm looking at her left eye, and they react to light together. So now I'm gonna look. Okay, and they're both reactive to light at the same time. Now I'm gonna check for the nose. I'm looking at the nose. It's moistened and it's pink. Okay, and the patient has no nasal flaring. And now I'm gonna check for the mouth. So I want you to open your mouth for me. And I'm looking at the moisten of the mouth. It's pink and has has no cyanosis and no parasite breathing, because I'm looking at her and she doesn't have those. Okay, now I'm gonna look at the knees. At the neck. I'm sorry. I'm gonna look for any enlargement of the jugular vein distension. Okay, and the patient has no enlargement of the vein destination, and no accessory muscles used. No accessory muscles used. And now I'm gonna palpate for the keratoid. And can you hold your breath for me? Okay. And can you breathe? Hold your breath. Okay. I feel her keratoid pulse. They're strong and they're equal. Okay. And now I'm gonna look at the patient's chest. I'm looking at the shape. No scars. No symmetry, and no efforts on breathing, and also no tripody. Okay, now I'm gonna palpate in 4 positions in the front of the patient chest. I'm using this portion of my hand. So okay, and now I'm gonna feel six positions from the back of the patient. So I'm gonna go right here. And I'm going bilateral to compare. Okay, and there is no vibration, no abnormal lung vibration. Okay, now I'm gonna listen to the lungs. Now take your left up. Again. Okay. Can we do this? And here I'm doing three places, because in the right we have 3 lobes of the lungs. Okay. And now I'm gonna listen to the back of the lungs. Take a deep breath. Take a deep breath. Deep breath. Deep breath. Deep breath. Okay. Now slowly deep breath. Okay. Deep breath. Okay. So there's no abnormal vibration. Now I'm gonna listen. So now I'm gonna palpate for the apical pulse. Okay, and now I'm gonna listen to the apical pulse as well, using my diaphragm. Okay. Okay. There's no abnormalities, and now I'm checking for the capillary refill. Can I see your hands? I'm pressing on the nails, and supposed to come back in less than 2 seconds. If greater than than 2 seconds, then the patient should talk to the doctor. And also I'm going to check for the toes capillary refill. They're coming in less than 2 seconds. Okay. Now now I'm gonna check for edema in the upper extremities and lower extremities. So the patient has no edema in her upper extremities and no edema in her lower extremities. Now I'm gonna check for the patient's abdomen. So can you lay down for me and can I see your abdomen? Okay, so the patient has no asymmetry. She has symmetry, and there's few lesions from giving birth, and her belly button is in the middle. And now I'm gonna escalate for the bowel sound. It's gonna be cold a little bit, okay? I'm gonna start from the lower quarter up to up. Okay, and if I don't hear anything, I'm gonna listen for each part in 3 minutes. Okay, now I'm gonna palpate her bowel sound is normal, and now I'm gonna palpate on her abdomen. Thank you. Okay, and now I'm gonna feel her organs. Okay, now we're done with the head physical assessment, and the patient has everything normal. So I'm gonna put the bed in the lowest position, put the side rails up, keep the call light in reach, and I'm gonna ask if she needs anything else. Do you need anything else?
I'm good.
Okay. I'm going to wash my hands and document.